Hi, this is Professor Wright, and we are going to go over medication administration today. Normally, when we do an injection, we would use our gloves. But for the demonstration, we're not going to use our gloves today. First thing that you want to do when you are administering medication is check and see what medications you need to administer. So I'm looking at my MAR, and I'm to give amoxicillin 400 milligrams and morphine 2 milligrams to F. Gordon. I want to first of all get those medications out, and I click on my supply, and you hear it unlock. There's my amoxicillin. The next medication I'm going to look for is the morphine, 2 milligrams. Here we are. Morphine. 1 milligram for 10 milligrams for 1 milliliter. Oh, I need a medication cup, don't I? First thing I want to do is check the label of my medication and make sure that it matches my MAR. This is one of the 6 rights. 6 times that you check your medication before you give it to your patient. And then I also want to check and make sure that this medication the dosage is within limit for the patient's age and body weight. And I look up amoxicillin. There we go. And I check the contraindications, dosage and routes, and make sure that I have an appropriate dose. 400 milligrams for my adult patient is an appropriate dose. I can do the same thing for the morphine, or I can look on the MAR where it says that this is an appropriate dose for the client's body weight. I can use the drug guide, or I can use an app on my smartphone. Next, we have our medications. We're going to go about preparing our medications, and we do that at the bedside so we can scan the medication before we give it. This is a syringe we're going to use to draw up the liquid medication. So I'm going into the patient's room, and first thing I need to do when I enter the patient's room is to identify who that patient is. I don't need to go in and say, "Good morning, Mr. Gordon," because then when I ask him, he's already going to know the answer to that. This is to make sure that the patient is not confused. So I go in and I sanitize my hands, come in and introduce myself and ask, "Mr. Gordon, how are you today?" And then ask him can he tell me his name, and I look at his hospital band, ask him if he can tell me his date of birth. We want 2 identifiers before we pass any medications. Another precaution to take before any oral medications are given is a swallowing test. Usually that's done before a client comes to the floor. A dysphagia test is usually done, and in this case we will assume from the medication MAR that he has already gotten his medication, his dysphagia screening, and he is able to swallow. Then we're going to pull up or scan his medication first. And then prepare that medication. I need to sanitize my hands one more time. And then draw up this medication. Doesn't have a, so I'll pretend like I'm drawing up this medication because we don't want to make a mess. Set this aside until I'm ready to give that to him. And then also scan his morphine and prepare it. This is a vial. It's a 1 milliliter vial and it has 10 milligrams in it. So we're going to give the equivalent of 2 milligrams. So that there's a drug calculation that you can do, and we know that we're going to give 0.2 milliliters. I didn't know that was going to happen. Okay, so in order to draw this medication out, we'll use one needle, but then we change our needle when we go to actually administer the medication. Needles can become very blunt after you use them the first time, and so you don't want to give a medication without a sharp needle. It decreases pain. I'm going to draw out some air before I draw out the medication. You draw in about the same amount of air that you're going to need to get medication out of the vial. So I've got about 0.2 milliliters of air. I'm going to insert the needle into the plunger and insert the air. And I'm going to draw out the medication to 0.2 milliliters. I'm going to tap, tap, tap to get rid of any bubbles. Okay. And then take the needle out of the medication. Don't recap unless you're going to do it with one hand. You don't hold the cap and recap the medication in the needle. Now, before I give the medication, as I said before, I'm going to switch needles because we want to use a sharp needle to decrease pain when we're giving the injection. And this will be discarded in the sharps container. Okay, now I'm going to go to my client, and I'm going to once again, if I had to leave the room to get any supplies, if I'm coming back in, I'm going to sanitize my hands and address the client again. I'm going to ask them, do they need any water after their medication? Just see what their preference is. Some people prefer coffee or juice. Ask them their preference. And then before you administer a pain medication, the vital signs need to be taken about 30 minutes before. And you also need to ask the client what their pain is. So on a scale of 0 to 10, ask the client what their pain is and record their answer when you go to do your documentation. And then you can go ahead and administer your antibiotics, which if you're going to use a syringe and administer oral antibiotics, you want to go to the side of the mouth. It helps the person swallow. And you administer that. And then for the IM injection, there are a couple of sites that you can choose. You have some videos that show you how to do injections in the deltoid and the ventrogluteal and the vastus lateralis. We're going to do, like if we were going to do the deltoid, go 3 finger breadths down from the shoulder and make your triangle and do your injection. It's an IM injection, so it's at a 90-degree angle, and you withdraw the needle after about 5 seconds, and you withdraw at the very same angle that you put the injection in. So just to give you an example of that, you want to clean the area first with alcohol, starting at the middle and going out. Give that a few minutes to dry. It actually takes about 15 seconds. Then you want to your 3 fingers from the top of the shoulder, and that's where you're going to do the injection. You go right in at a 90-degree angle, and you do it with a darting fashion. And then you express the materials, and it's kind of coming out the back there. And withdraw the needle after about 5 seconds at the exact same angle. Okay. Then you have your gauze or a Band-Aid to put on the site. And you're finished with your injection. This goes into the sharps. And once again, you don't recap anything with 2 hands. Okay. So we've administered PO medication, we've administered an IM medication, and we make sure that our client is comfortable, safe, their rails are up, and they've got their call light in reach, and we finish with the medication administration.